Listening to podcast is no replacement for real training. While we attempt to provide accurate commentary, we hold no responsibility on how you use the information we provide. Get medical training. In the blink of an eye, everyday order can be replaced with once-in-a-lifetime chaos. Be prepared. This is the Civilian Medical Podcast.
Awesome. I think I got it. So, hey guys, welcome to another episode of the Civilian Medical Podcast. We're on episode 78 this time. My name is Dietrich. I have co-host Bobby Wells. You just got off a big trip, right?
Yes, we just got back from visiting family in Maine. Every year, my cousins and all their kids, we get together and we go up to what used to be my grandparents' house, is now my parents' house on a river, off grid, and we use that as a jumping off point to do a bunch of different outdoor activities. So on Saturday morning, we packed up the canoes, and about 20 of us and 8 canoes, I think, drove way upstream, put in, and then spent several hours paddling down through the middle of nowhere. I think we pass one house that is usually appears to be uninhabited on that trip, and then we spend the whole weekend pretty much off the grid. There's like one place on the property you can go stand and get a decent cell phone signal to send text messages, but a lot of fishing, a lot of kids, and we had a great time. But one of the things that really popped into my mind before we went on this, and I consider it every year, but this year, particularly because of the things we've been discussing on this podcast, was really around how do we get prepared for it, and whether or not we have all the equipment, the training, and the preparation that we need to be ready for an off-grid situation.
Definitely, because if you call 911, it doesn't sound like you're going to get an ambulance super quick, so you may be some time by yourself.
Yeah, I mean, if we're right there at the house, there is a volunteer fire department in town with an ambulance. So you'll probably get somebody on scene in 15 to 20 minutes. But if you're out on the canoe somewhere, then you have potentially a much longer time to get some help. There's no fire department boat that's in the water at any given time. So it could be a pretty prolonged period of time before we get any help.
Awesome. So we're going to kind of talk about thinking about being off grid, being away from medical for a little bit, and then talking about kind of building a checklist for a first aid kit, like for summertime, like what we're thinking there. So should be a pretty good episode. I'm looking forward to it.
Yeah. So I guess, we'll start with a quick scenario of what if we're on this canoe trip and someone collapses or has a medical emergency, someone experiences a trauma. What are the things that we're going to start thinking through as we're addressing that need? So first, you already mentioned the prolonged response time of EMS. So I think that's one of the biggest concerns we have to think about, is how long it will be before someone else who's trained gets there.
Mm-hmm. I think not even on the medical side too, is like, where are you at exactly? Because, I'm on the third bend of the river. Like when you start calling 911, like if you're that remote, that where you're at, giving GPS coordinates or longitude, because I would imagine there's not a road super close by. So hey, I'm at 113 Laurel Valley Road. Like that doesn't work where you're at. So like the location to where you're calling 911, I think is important as well.
Yeah, and especially knowing where you are in relation to the nearest place that you could access a road would be very valuable. There is the place where we were, there is a road that somewhat intersects occasionally with the river. So they kind of weave back and forth, and occasionally you can hear traffic, but being able to communicate that to a dispatcher is really important.
Even you said like getting cell phone service, 911, be able to call for help, I think is something to think about too, because you're saying you don't have a signal, it doesn't matter. Like you could have all the supplies, like you got to still get help there. So lots of things to talk about. So I'm pretty excited about it.
Yeah. Fortunately for us, with my family, we have a embarrassment of riches when it comes to training, because I was there as a paramedic. I have an aunt and 2 cousins who are nurses. One's a neuro nurse, and one has She's a COO of a hospital now, but she was a clinical bedside nurse for a long time. And then we also have a veterinarian in the family who was on the trip. So it was nice to not be the only person on the trip and think, well, if something happens to me, I'm done.
Yeah, definitely. I think it takes a little bit of weight off your shoulders. So we kind of talked about EMS is 15, 20, maybe 30 minutes to several hours away. No cell phone service. So like thinking about how to communicate, whether it be a Starlink, ham radio, we've talked about on this podcast before. So how do we communicate? Do we get help? And, location. Those are all things you want to pre-plan. Like, I think you got to have a game plan going in there is, hey, we have a ham radio. So-and-so is listening, monitoring where we're at. We have a Starlink that we could set up, deploy. We have a satellite phone, sat phone, things like that. So I definitely think you got to have a pre-plan for that. And then what about the weather? Like, was it raining? Like, what was it doing for you?
Well, it was Maine in the summer, so it was gorgeous. We had a couple days where it rained, but for the most part, the high was around 80 during the day, down into the 60s, maybe around 60 at night. So we had really good weather. We did have some rain, so there would be some chance of, if you were out overnight and you got rained on, there'd be a slight risk of hypothermia. But for the most part, the weather was very cooperative for us.
Yeah, and like, as you know, being an EMS, that's going to change. Like, do we go by ground? Do we go by helicopter? Like, all that could be changed. Even if you have a critical patient and it's raining, monsooning, the ceiling's not very high, they're still not going to fly that patient out. So from an EMS standpoint, that definitely brings some, different thoughts to the process as well. You're got to be self-sufficient. Your family's got to be self-sufficient for anywhere between 30 minutes to a couple hours. What kind of gear? You have canoes, right? So what are you thinking about? Like, you're still limited on your gear. Like, you can't take, everything you'd want, but you got to have a plan for your gear as well, right?
Absolutely. Well, first, I think from a safety perspective, everyone has life jackets on the river. If we're on flat water, maybe some of the adults aren't wearing them, but the kids are always wearing them anytime they're in the canoe. And I think that makes a huge difference when it comes to the risk of any sort of capsizing or anything like that. Then in terms of a first aid kit, I carried my standard kit that has a bunch of bandages, splinting equipment, 2 tourniquets, and a good pair of medical shears. I did break the rules and I took the medical shears out to cut some fishing line, and I'm pretty sure I left my shears in a tackle box in Maine. So I have to dig out another pair from my stash somewhere or order another set from you. But
I was like, I think I know a company that has medical shears if you'd like to order them.
I've heard you have some really good ones too. The ones I have are still standard. They were, back in the day when you could still get a pharmaceutical company to sponsor a bunch and give them out. They're that old, but I'm due for a new pair anyway. So I'll go on the website and order some in a bit. But I had that kit with me with all of the trauma gear that I could foresee that I would need. I was thinking about it a little bit on the trip. I don't have a chest seal in there. It's a pretty small portable bag. It's what I could fit into my carry-on to take up there. So no chest seal, no foil blanket or anything like that. But all of the bandaging and a few splinting things, and of course the 2 tourniquets were in there.
Nice. What about, like, how would you get somebody off the water, like, to the nearest roadway? Like, are you gonna have to carry them? Are you gonna have to make like a litter? Like, what would be a plan there?
Yeah, that was definitely one thing that I was thinking about. Because there are a few places along the river where the road comes close, I would probably try to get them downriver in the canoe as much as possible to one of those places. The brush is really thick. There are some game trails through there, but probably transporting downstream a mile or 2 at the most would be the best option. Again, there was one house along that trip where I'm sure there was a driveway to get an ambulance in there. Even if they didn't have a phone or something that we could use. And I think I mentioned when we were talking a couple months ago about ham radios and such, I got a notification from T-Mobile, who's my cell carrier, that they now have a deal with with Starlink, where our phone can connect to it if we are off grid and unable to get to our normal cell network. We can connect, make emergency calls and text messages to 911. So that was really neat, because I noticed as soon as I got to the point where my network cut out, that satellite connected, and I had good reception with the satellite. I couldn't use it for any data. I'm not listening to music or anything with it, but if I needed to make a call, I felt much better that I had the ability to call 911 even beyond the normal cell network out in the woods.
Nice. So you've done a good bit of Maine. Like, I've done some search and rescue here. You've done that as well. A lot of hiking. So what are some kind of common emergencies that you can think of, like, we're going to deal with when we're off grid in the wilderness, away from the city lights?
Yeah, I think you get any type of bleeding and trauma, head wounds. Think of canoeing. You think of there are some small rapids on this river. I don't think in the history of our annual trip anyone has ever capsized on this particular river. I have capsized on a different river in Maine before. So there's always a risk as you're going through faster water of hitting your head, having a head injury. That's where it's really important to have the life jacket, so that it'll keep you above the water until someone can drag you out and you don't drown. If you're fishing, of course, you have knife injuries, you have hook injuries, you can have an injury from the animal. If you're hunting, you could fall out of a deer stand. I remember one time back in the county where we worked, having to hike way into the woods and get someone out who had fallen out of a deer stand and fractured their back. I forget which vertebrae it was, but they were certainly not walking out of there. So tree stand falls are always an issue. And then you could just have anybody like trip and fall. We had a few people on the trip that were 70 plus years old, and it does not take a lot at that age to have some sort of fracture that we would need to address, stabilize a hip, stabilize a leg, get them somewhere where an ambulance could get to them. Then of course, we went in the middle of summer, so it was pretty warm. So you do have the risk of heat stroke, particularly in your area in South Carolina, or where I am here in Texas. If I were doing this sort of thing, I would be thinking a lot about water, electrolytes, and things like that. In Maine, we all had water with us and some electrolytes, but it wasn't quite as big of a concern. If we're up there in the winter, definitely a hypothermia concern, and thinking a lot about, do I have a blanket with me that I could put on somebody? Do I have the ability to start a fire and provide temporary shelter if someone's injured? And then of course you have all of your normal medical stuff, like shortness of breath, respiratory problems, chest pain, cardiac arrest. All of those things are compounded by being out in the middle of nowhere, and allergic reactions as well.
Definitely definitely complicates things. Having limited supplies, limited resources. You're saying even we think about hyperthermia right now because we're gonna have a heat index into 110s here this next week in South Carolina. But you're saying it gets down to 60. So if I got Maine at night, even if you have someone who's down in the water that you've got out, you've got wet clothes, hypothermia could be a real issue even in the middle of summertime. For sure. Just due to the environment that you're in.
Oh yeah, and those spring-fed rivers coming out of the mountains are not warm, so it is not easy to get your body, or it's not hard to get your body temperature down after a minute or two in the water.
Definitely. So kind of thinking about while EMS is coming, we started out this podcast years ago and went through the March algorithm. We've talked about doing a patient assessment, things like that. So just kind of, if you're just now catching the podcast, go back and listen to those early episodes. And we went through the March algorithm, thinking about an assessment, doing good, because doing a good assessment is going to give more information back to our 911 providers that are coming, that they know that maybe they need more resources on standby, or they need a technical rescue team, a search and rescue team, or they just need an ambulance, like what kind of resources they need. But that starts with us giving good information to the 911 dispatcher.
Yeah, I think it brings together a couple different podcasts we've had. So like you said, the early patient assessment March, we had a lot of talk about communication recently. What do you tell the dispatcher? What information are they going to want to know? So looking at all of that, is the person responsive when you say something to them? Do they respond? Do you have to, do a sternal rub or something that inflicts a little bit of pain on them to see if they respond? Are they entirely unresponsive? Are they breathing? Are they bleeding? Massive hemorrhage for March. How is their airway, respirations, circulation, and is there any risk of hypo or hyperthermia there? I think if you can have that basic information as you're calling 911, then that's going to go a long way toward being able to give them an idea of what they need to send as far as medical resources. And then where are you? How far are you from a road? How far are you from a clearing? Do you know your coordinates? That's going to go a long way toward telling them what they need to send as far as search and rescue, extrication, or other types of resources. So I think it's something you can do while someone is calling 911 is start to put all of that together if you have a group. But it's important to have that information so that you can communicate that pretty clearly to the dispatcher.
Yeah, definitely. And think about the March algorithm. That is all things that's going to kill them. The splints, the broken ankle, yeah, while they're painful, it's not going to kill them. Like, you're not going to die because you had a broken ankle. Like, you're going to be really uncomfortable and things like that. So think about the March algorithm. What is going to kill this patient before EMS can get there? So having those supplies is, I think, is important. Like, yes, we'd like to have a splint, some ice packs, whatever, that, if in the perfect world, but you may not have the room for it. Like you said, you're carrying a kit that you had to fly with. So thinking about if you had to limit your resources, I think you did a great job by saying bandaging supplies, because boo-boos are going to be a probably your most common thing. Hopefully you're not throwing a tourniquet every time you go down the river at Maine. But at least having the ability to control major bleeding and things like that is going to be important, because we know that's going to be the first thing that's going to kill our patient. So having the ability to control major bleeding is a high priority.
Absolutely. And particularly if you're traveling with strangers or people that you don't feel comfortable giving mouth-to-mouth resuscitation to, I would want to have some sort of mask or something to give respirations to. If they're in full cardiac arrest, of course, we talked about hands-only CPR being appropriate. But the evidence only supports that as being effective for a few minutes. And after that, the benefit switches to ventilations and compressions. So if you're going to be anywhere off grid, you do want to have the ability to have some sort of barrier between you and the people you're around, unless you feel really comfortable putting your mouth on their mouth.
No. And then I think just like some improvising stuff too. You're talking about, maybe you have to use T-shirts. Maybe we have to build a splint, out of tree limbs, stuff like that. Maybe we have something in our supplies that we can, a sleeping bag or something like that, we can make supplies with. So being able to have items that have multiple uses is always, I think, is a nice feature that you have. If you're going to carry the weight, you're going to take up the space and let it have multiple things you can use it for. So,
yeah, you don't really want to be creative with a tourniquet. Ideally, you want to have an actual tourniquet with a windlass, preferably one that's not a Chinese knockoff that you bought on Amazon. That's where you really don't want to try to scrimp and save and be creative. But with splinting, you have a little bit more flexibility. If you have fishing poles available, or if you have the ability to get some sticks that will work well, pad with jackets, all of that stuff, canoe paddles, whatever you need to splint it and secure it. You can be really creative with splinting, but don't plan on being creative with your tourniquet. Use a real proper tourniquet.
Definitely. So you're kind of like thinking about what you're going to carry. Like, if you could build, an off-grid first aid kit, and we're going to ship it UPS, overnight it to Maine. Like, what are you thinking about? You'd want to add to that kit?
So tourniquet for sure, at least one. I like to have two in my kit, just because, number one, maybe you have more than one patient. Also, sometimes there are bleeds that you would like to add a second tourniquet just to be safe, especially if you're looking at a prolonged transport. If I'm 10 minutes from the hospital and they're still bleeding a little bit, I'm not too worried about it. But if we're an hour and a half to 2 hours out, I'm worried about it. And I'd apply a second tourniquet. You don't want to get a tourniquet on, realize that someone's still bleeding a little bit, and then like loosen it or adjust it or anything like that to try to get it better. You add a second tourniquet. So I would say have two tourniquets on you. Again, proper tourniquets. Have plenty of gauze. If you have some gauze that has some sort of clotting factor in it as well, that's really good. A CPR mask or a face shield of some sort is good. If you have anybody going with you who has anaphylactic or allergic reactions, have injectable epi, and have either Benadryl pills or injectable Benadryl. Particularly if you're doing anything where you're going to be in a tree stand or working with firearms, a chest seal, I think, is a must-have. A puncture to the chest, there's just really no good substitute for a chest seal. There's all sorts of improvised things that you can use, but exactly having a proper chest seal is important. We talked a little bit about hypothermia, hyperthermia. So along those lines, I would have an emergency blanket. That's the one thing I really felt like I should have had that I didn't have on this last one. Have splinting things, have a fire starter. So if you're in the winter, you can start a fire, you can make some shelter if you have some duct tape and other resources around you. In the summer, make sure you have electrolytes. We're still waiting on that Liquid IV sponsorship, but we've been talking about them a lot. Or one of those other groups. I did try some of the Element ones recently, and I really liked those. But have some. Don't get heat stroke. Don't get overheated. Make sure you have plenty of water. And then think about what else you have around you. Like I was saying, we have life preservers. We have canoe paddles. There's things that you can use for padding and splinting if you need it. You don't necessarily have to carry a full leg splint in your first aid kit. But that's what I would put in a ideal off-grid summer adventuring first aid kit for myself.
Yeah, I think about a container to put all that stuff into, just as a little bit of additional. You have some great supplies, but think about having a kit that you could label as a first aid kit, because maybe you can't get to it. Maybe you need to send your sister, maybe you need to send your aunt, somebody like that, to go get it. But there's some cool kits at Medical Gear Outfitters that have some nice cases and be able to. I think about water, especially around the canoe. I probably don't want to go with the Condor bag, being completely honest with you. Like, the Condor makes good equipment, but that's just going to soak up the water. So do I want something that's vacuum sealed, that's going to give me a little bit of protection? Do I want to put something that's in a Pelican case? Things like that. So think about, or just even a plastic container that's got a lid, at least something to protect all that equipment from the water, the sunlight, the weather if we need to. But just have that kit labeled as well. But I think you nailed it with all the right supplies in there.
Yeah, I have an old bag that's got, I don't think it's waterproof. I think it's water resistant, but it's bright red. And so it's really easy to identify anytime I'm pointing someone toward it. I do like the idea of the Pelican, because that also gives you the option that it's probably going to float if you capsize. Because if I have something that sinks to the bottom of the water when we capsize and somebody hits their head and we have to treat a gash to the head, it's not going to help me at all. So I think thinking about the activities that you're in, like, do I need something that floats? Do I need something that's waterproof? That's really important. And what's the name of the one you have that comes in the Pelican case?
It's the IROC kit. I was going to see if I could pull it up, and I don't know if I can do it or not. Let's see. Yeah, look at there. So let's go to.
Getting really high tech here now.
I know. Sean will be so proud.
Share your screen.
This one comes in a nice Pelican case, and then has a little bit of mixture of those boo-boo kits and the life-threatening like we talked about. It has a cat tourniquet, some gauze, non-hemostatic gauze, but we can swap that out. If you click on this, you can switch into either combat gauze or Celox Rapid. Has a pressure bandage, has a chest seal like you talked about, has some butterflies, Band-Aids, some burn gel, has a CPR shield like you've mentioned, some different kind of ointments, has a survival blanket, has gloves, has duct tape in there, and then comes with some directions just in case like you need to. But doesn't come in a bright case. Like, they used to have some bright yellow, orange cases, but they kind of did away with that. Now we just have the black and OD green. But to me, like, if you're out in the wilderness, you're on a side-by-side UTV, like, this is a great kit. I did a review on the Skinny Medic channel talking about this case in particular, and I drove over it, and it held up just fine.
Yeah, I think that's like a really good option, and you can throw some bright stickers on it or something if you want to make it a little more visible. I think that's the easiest problem to solve from all of that. But that sounds like a pretty good kit for what we would have needed.
Definitely. And then like the skinny, let's see, essentials, if I can spell essentials. So, and we don't need the OB essentials kit, like the skinny medic essentials kit. This one is vacuum sealed. So
if you're going off grid, don't go with someone who's in their 3rd trimester of pregnancy.
Yeah, like if you're going off grid 3rd trimester, I will send you a free OB kit. It'll be fine. But this one is more vacuum sealed, so it's going to keep the dust and the rain off of it. I don't know if it's going to be waterproof, but it's going to at least protect it a little bit. And it comes with a cat tourniquet, pressure bandage. It's got the survival blanket. It does have an MPA if you're trained with how to use that. Has galls and has like the Benchmade hook. So it doesn't have trauma shears, but has a hook in there. There again, it's vacuum sealed. So it's going to protect it a little bit there for you. And it's a, you could throw this into a backpack, throw this into your other gear, and it's going to stay protected.
And which one is that? I can't see it on the, you're not sharing your screen right now.
Let's see. Sure. That was the Skinny Medic Essentials kit.
Okay. Very good.
So.
All right. So we talked about having the right gear. Always think about the right training. So we'll get to that in just a bit. But other than satellite phone, the other thing I would say for emergency communication is leave a plan with someone who knows where you're going to be, particularly if you're in a smaller group. If you don't show back up at the end when you're supposed to, you need someone who knows where you're supposed to be, what the route is, so they can kind of backtrack and figure out where you are. For us, we had a few people who did not want to sit in a canoe for hours on end and stayed back at the house. And so we left with them what we were doing, what our plan was for the day, where we were going to be, and when we would check in with them. And fortunately, we didn't have any issues, no delays. We were actually back, I think, a little bit earlier than we anticipated. Water was a little high, so the current was running pretty good. And caught some fish along the way, so everything went well for us. But it's always good to make sure that somebody knows where you're going to be when you're going out.
Definitely. Yeah. Have a plan. Like I said, a lot of pre-planning, a lot of just thinking about the what if scenario will stop the emergency on the backside. So, just being prepared. And there again, I know you're kind of limited on your gear. Where we can either, if you're taking a backpacking trip, something like that, like weight is everything. You don't want to be carrying a 75-pound backpack when a 30-pound would do just fine. So pre-planning, laying all your gear out, making sure it's ready to go, it's in good order, will definitely save you on the backside.
Yeah, I'm a pretty experienced traveler, but I still always feel like after every trip I get home and unpack my suitcase and there's always something in there I didn't use. And I've done some backpacking out west years ago, and we definitely came back with some things that we were like, we never used this, we didn't need it. But I think a first aid kit's always something that's worth having on you. Obviously, when every ounce matters, you want to be as minimalist as possible with it, but at least make sure you have the essentials in there, tourniquets and bandaging things, and be ready in case there's a life-threatening emergency.
Definitely. So what kind of training, what kind of classes do you think people should look at and think about if they've got a big trip plan?
I think at the very basic level, there's always a first aid course like what the American Heart Association or the Red Cross offer. Stop the Bleed. There's lots of those. If you want to go a level above that, there are wilderness first aid and wilderness first responder courses that can give you a little bit more depth and provide some additional application for the context in which you're going to find yourself off grid, outside of the normal resources that you would have available. NALS, which is the Outdoor Leadership School, they have some classes that they offer. First aid, wilderness first aid. I think they even have a wilderness EMT class that they offer for people who are already EMTs. And beyond that, I would say it's just important to practice. So if you buy a tourniquet, buy a second one that you can practice with. Practice putting it on your own leg, practice putting it on someone else's leg, arm. What do you do if you only have one arm available to put it on? I know a lot of police officers that carry tourniquets that do that sort of practice. So if they're shot in one arm, they're using the other arm to practice putting that tourniquet on. You don't want to be using a tourniquet for the first time when you're trying to save your life or save someone else's life. So for sure, at the least, get a first aid class, take a Stop the Bleed class, learn how to apply a tourniquet, actually put your hands on a tourniquet and use one. But particularly if you're going on a larger expedition or adventure, or you're responsible for other people, I would look at a wilderness first aid or wilderness first responder course.
Yeah, and I think about like a CERT program too. I know that's a big talk, especially in our area. They're trying to get the CERT program started back up. So they're looking for civilians to get medical training, get triage, get that kind of training. That way, in a disaster, you're able to help first responders with, the big things. You're not going to be a paramedic, you're not going to be an EMT, but you at least have some basic first aid training. They're going to teach you a lot about triage and logistics of a natural disaster, stuff like that. So you can get a lot of great training through your CERT program. So I would talk to your emergency management program just director and see about if they have a CERT program, and it's voluntary, but you can get some good training that way.
Definitely. And so I have here, this is a book I would recommend, Wilderness Medicine by Knowles, that National Outdoor Leadership School. So I can get it without the glare. That's a really good, it's a small book, and I think it's really convenient. It has a lot of great advice. This one's old. I've had it for a long time now, but I think they probably have an updated one. Yeah, this is from 2006. They probably have updated it 5 times since then. But it's a really good book, and I used it many times before the wilderness adventure races to kind of brush up on a few of the medical techniques that we would use that would be different when you're in that sort of setting. So I would definitely recommend picking up some books like that and reading them, and listening to these podcasts, watching YouTube, and getting some formalized training.
Does the book have pictures, or?
It has some graphs in it. So, stuff like that. It's not all words.
Kind of like color in it too. Like I need
no color, but some spiders. You can get your wife to read it to you. I think anything else for off grid? Anything else you'd want to say?
No, I think so. I think just having a plan, like if you don't have any medical training and you're thinking about taking a trip this fall, this winter, go ahead and start working on that now. Medical supplies are expensive. I get it. So start budgeting out and maybe you're gonna buy a tourniquet this month. Maybe you buy some gauze next month. You buy Band-Aids. So kind of work on that. Remember that you can use your flex spending accounts or health savings accounts to buy those kits and buy those first aid supplies. So you got those accounts, don't let them go to waste, and you can use that money to buy your supplies.
Yeah, that's a good idea. I forgot about that. I'm gonna use that to buy my shears.
There you go. Yeah. So we deal with that all the time. Medical gear outfitters, people probably every other day send an email going, "Hey, can I use this account?" Yes, you can use your account. So no big deal. They'll first aid kits, trauma kits, all the supplies. They will reimburse you for that, or they'll let you spend your credit card wherever you need to. So easy
Excellent.
done. So, but yeah, just thinking about if you have a trip coming this fall, this winter, get some education, get the right gear, start using your gear now. Like you were talking about the canoe and stuff like that. Like if you're going to buy a brand new pair of boots, don't keep them in the box and run to your trip. Get them out of the box, lace them on. You're like, I'm ready to go hiking. It doesn't work that way. So get your gear out, get your boots on and your backpack, and make sure it fits right. And you're ready to go and start getting ready for this fall and this winter.
Yeah, and if you're going on a really interesting expedition, you can invite us, and we'll just provide the medical coverage for you. So there's a business model there. We could do some sort of consulting work where we go along with people on their elk hunting expedition in Wyoming.
Yeah, we're easy. It's not cheap.
Yeah, for sure. But we're available. So this is the July episode. For August, we have a guest coming in, a meteorologist. You want to talk about that a little bit?
Yeah, so I have my friend Jessica. She used to work in emergency management, and now she's went to another company to work. I guess I can say the company, Bear & Weather. They have a fantastic software that's set up for weather alerts, things like that, for counties to use. My county actually just purchased it, along with other areas. Just purchased it. Man, I use it all the time. It uses AI generation to pull data and wind speeds and things like that, and it's awesome. I can be a meteorologist in the living room for Candace. I put my suit on and I present, like, this is the storm tracking. This is hail. This is where the wind's coming down. So I can play that in the living room for Candace, and she gets all excited. So she doesn't need Chris Justice anymore in his updates.
That's right. And there's pictures, so you're good.
Yeah, it has pictures, so we're good. So, but yeah, hopefully get her scheduled and get her done, and we'll have her on here next month. And she's going to talk about, what kind of alerts we need to be looking at, talking about apps that we need to have on our phone to be ready. One thing she's taught me is about looking at the radar and looking for shrimps. If you see a shrimp on the radar, that means that's a possible tornado that's on the ground. So anytime I'm in a group text with her, so anytime someone posts the radar, we're like, do we see any shrimps? So that's what we're looking for. So she can talk about that. She's awesome.
That's interesting. It seems like we'll probably need to do some screen sharing for that, so that if we can look at some of the things she's talking about on the screen for next month. So that'll be super interesting to listen to.
Yeah, definitely.
All right. So until then, get the right training, get the right gear, and we'll see you in August.
Awesome.
Find us and subscribe at civmedical.com.